Some have always dreamed of becoming doctors, saving lives, writing prescriptions, speaking medical jargon no one understands. But for some of the geniuses in this story, the dream was a little different. Becoming a millionaire just by signing a piece of paper. In the world of medical fraud, there was no shortage of talent. Let's take a look at some of the rising stars and their downward spiral into prison. Dr. Jorge Zamora-Quezada, the king of drama. Imagine a rheumatologist who doesn't treat pain, he creates it. Dr. Jorge from Texas wasn't just a doctor. He was the executive producer of the biggest healthcare scam in history, $118 million. That's how much he billed Medicare. But the poor system only paid him $28 million. What did he do with the money? A private jet flies over his victims, a Maserati that resembles his shiny teeth, 13 luxury properties in places like Aspen, Puerto Vallarta, and Punta Mita. His health accomplishments? Diagnosing patients with diseases they never had, sometimes giving them toxic medications. He served 10 years in prison, but can the justice system ever heal what he did to hundreds of lives? Dr. David Young, signatures for sale. Texas again. The air there seems to be tainted with the stench of fake bills. Dr. Young decided he didn't need to see patients. A signature would do. He signed bills for genetic tests, knee and back support devices, and things that never reached anyone. $70 million in bills. The system paid. The doctor smiled. But his smile froze when the verdict came. 10 years in prison plus restitution of $26 million. Dr. Babatunde Akinboye, cold heart. From New York, a renowned cardiologist came, but it seems his heart was preoccupied with a love of big numbers. $1.9 million is the value of the bills he submitted on behalf of patients he'd never met. Yes, the signature alone was enough, and he probably didn't even know the patients' names. He was arrested in June 2025. The case is still open, but he certainly won't be lecturing on medical ethics anytime soon. Dr. Javed Iqbal, the fake therapist from California, where the sun rises and fraud rises. Dr. Javed, a psychiatrist, used his office as a copy machine to bill fake psychiatric treatments. $2.9 million is the total bill. But the patients? He didn't talk to them. Maybe he was talking to himself. The sentence? 4 years in prison, and the state recovered $1.5 million. Dr. Roshan Shah, master of DNA. From New Jersey, this anesthesiologist became embroiled in a web of genetic fraud, unrequested DNA tests, forged signatures, and $6 million diverted from patients' trust into his own accounts. He was arrested in May 2025, and his name was placed on a list of doctors who were once doctors. And so we come to the end of the chain of doctors, where the tools used in the crimes weren't guns or knives, but a pen, a billing pad, and a wide-open bank account. In a quiet place on a small balcony sits Gerald Quindry, a 73-year-old retired engineer. The only muscles still functioning efficiently are those of his eyebrows when he is surprised. He receives a letter from Medicare in the mail, and he says to himself, "It looks like they sent me a certificate of appreciation for my retirement." But when he opens the envelope, he finds a bill for $15,500 for a urinary catheter. He sat thinking, a catheter? For whom? The last time I was hospitalized was to visit our neighbor during the Vietnam War. But don't worry, Gerald. You're just one name on a long list of elderly and disabled people whose data has been skillfully used to steal millions. In another, more dramatic scene, or rather a black tragedy, a devastated mother recounts the story of her son who suffered from mild insomnia. A healthcare genius prescribed him a prescription containing opioids more powerful than a nuclear bomb. And he died. Not one, no, 5 patients died within 30 days of receiving similar prescriptions. The mother exclaims, anger in her eyes, "My son wasn't addicted. He just wanted to sleep a little, not sleep forever." And of course, like any good play, the official characters appear on stage. Matthew Galletti, head of the Justice Department's Criminal Division, entered the scene with a fiery statement. What's happening isn't just falsified invoices, it's theft of people's lives, and a direct contribution to the spread of opioids, and the deaths of patients. Dr. Mahathir Oz, administrator of Medicare, was more poetic. These aren't the work of amateur operators. This is a conspiracy. People aiming to undermine Americans' trust in doctors and medicine. Imagine a doctor who's more like a crime boss than a pediatrician. As the prosecution talks about 324 defendants, including 96 doctors, nurses, and healthcare professionals, a sad, haunting theme plays in the background. Lost trust. Trust gone forever with the first unnecessary prescription, the first catheterization that didn't happen, and the first forged medical signature. Can we ever get it back? God knows. But we know that the victims paid the price, and the thieves boarded private planes. That wraps up part 2. But trust me, the real shocker begins in part 3. Don't go anywhere.